the operating table. My name is Najeeb Thomas. I'm a neurosurgeon and medical director at Crescent City Surgical Centre. This program is designed for patients. We discuss medical conditions, medical treatments, and medical symptoms as they relate to you, the patient. And we ask all of the questions that you maybe forgot to ask, never knew to ask, or maybe sometimes were scared to ask. We bring patients, we bring doctors, all so you can understand the medical process involved in your care. And it's done in a very relaxed fashion. We hope you enjoy the operating table. And please, give us a like. Hello to everyone. We're here with Erica, our next patient here on the operating table. Erica, tell us a little bit about yourself. How old are you? Tell us about your life, what you do day to day, and obviously you're dressed in some of the hospital garb. Tell me a little bit about what you do.
So my name's Erica. I'm 43 years old. I've been a nurse for 20 years.
20 years.
I've been working at Crescent City Surgical Centre for the last 2.5 years. I'm a mom of 3 children, and we live a busy life.
How old are your children?
23, 11, and 10.
Wow, so kind of run you around, huh?
Mm-hmm. Always
Pretty
at a ballpark or a gym, school.
Wow. So, and then you work here as a nurse. Which part of the hospital do you work in? Tell everybody.
The recovery room.
So that's, we talked to some people and seen some of our some of our programs before. That's the recovery room is after people have anesthesia. When they're waking up from anesthesia, they come there when they're sort of groggy and wake up until they can be safely transported brought to an area of lower level of care or lower level of acuity. We see it. So you take care of some people that sometimes they're sort of humming right out of the operating room, but sometimes they're can be very, very labile. I mean, their blood pressure could drop and they need your attention immediately, or for instance, the breathing tube may need to be reinserted. So it can be a job that you really have to move fast on your mind and move fast on your feet, because when things go well, like most things in life, they go well and they go well until they don't. And then you have to kind of move in and sometimes do some things that are pretty critical to save a patient's life, huh?
Yes.
And so you got to be able to use your neck and your back and your arms and your legs, right?
And we're always pushing stretchers, wheelchairs, picking people up, pushing them up in the bed.
That's right.
Physical.
It's a great question. You know, a PACU job is very physical, and you know, people don't understand that. A lot of doctors don't understand it. You know, when someone wakes up from anesthesia, it's like being punch drunk or completely out of it. So they've had these medications, they've had surgery, and they can't move their arm or leg because they've had surgery on their arm or leg, whether it be an orthopedic procedure. So here you are, sometimes trying to pick up a 250-pound man and slide them up with someone, 6 or 8 inches into the bed because they've fallen down or they're leaning on their wound. So it can be a pretty physically demanding job from time to time, certainly, right?
Yes.
Yeah. That leads us into our next thing, and why we're here. You had some issues with your back. Tell us a little bit about that. I mean, you're doing great now. You're smiling and happy and taking care of the 3 children. But when did you start having back problems? I know you've had them off and on in your life, and I guess early on you had some. Tell us a bit about that, and then what progressed you to when they became different.
So when I was 16 is the first time I can remember that my back went out. And throughout the years I've had problems where some days I couldn't even get out the bed. It would be difficult to get out the bed. I could be brushing my teeth and my back could just go out from the slightest movement. I've gone to physical therapy on and off throughout my life. And I've just found as I've gotten older, my little episodes have lasted longer, have become more, I guess, almost debilitating. Like I've had to call into work a couple of times throughout the years, and it's just gotten worse. Almost a year ago, I started having, it was so bad that I would walk crooked. I was having trouble getting in and out my car. Was
it the same type of pain or a new pain? You had it off and on when you were 16, but something changed about a year ago, huh?
So it was to the point where it never went away. It was always there. I'd have pain in my back, side, down my leg. And then I had an epidural steroid injection.
So it progressed from this episodic back pain about a year ago or so to more intense, more consistent back pain and then pain down the left leg, which led you to get a MRI scan, which people get, right?
Yes,
Was it your first MRI?
it was.
Was it scary?
I just kept my eyes closed.
Was it loud?
It's loud, but they put headphones and you have music on. And I feel like as long as you know what to expect, you can.
What'd you listen to? I'm always curious of what people listen to. Was it classical music?
I think I listened to like soft rock to kind of have a little peace, so it wasn't like hardcore, and because I was already nervous.
Did it seem like you were in the thing for 2 years?
It did, and it was freezing.
So you're cold, uncomfortable, and loud. It's a big step to get the MRI, huh?
Well, and also to get on the table, I almost couldn't. My back was so bad at the time. I had to like roll sideways. The girl had to help me. I really didn't even think I'd be able to get up after.
So your back was so irritated and your pain was to such a degree. You were in a lot of pain. And you know, you're not a BS person. You're a mom of 3. You're taking care of people in the recovery room, which we discussed, moving heavy people around, people that need you. And now you're debilitated, because I want people to understand how debilitating this can be. I mean, you had back pain off and on. You'd lived with it. You'd managed it. But now you're at a point where you can't move. You can't get on lay on a MRI table, and you felt like you were 80 years old. I mean, you have back pain. Was there numbness, tingling, weakness in your leg, or what was going on?
Well, after that MRI and my steroid injection, I did 5 months.
We had the MRI.
Oh, okay.
So you had this MRI, and what were the symptoms? You couldn't get off the table. It was back pain, leg pain. Tell me a little bit about more what was going through your mind at this time when you can't move and can't take
It was
care of
like
your kids.
it would tighten up, and you knew if I moved a certain way, the pain would just make you want to pass out. It was
What were you taking for pain? Advil, Tylenol?
Motrin. Yeah, Advil, lots of Advil.
Did any doctor give you any pain medicine?
No, years ago, but I don't do good with pain medicine.
Yeah, it kind of makes you a little goofy.
Yeah, I gotta continue to raise my kids and drive and function.
Yeah, it's hard. You know, it's we are in somewhat of a narcotic epidemic in this country, but it's interesting. You didn't like the way it made you feel and didn't really give you relief, and sometimes the pain's so severe that narcotics can be very difficult for them to even give you relief. So you were sort of chewing ibuprofen, Tylenol, living with it, and
I feel like with the pain, no medicine worked.
works. Yeah.
Nothing.
Now, when the pain a year ago or so was really severe and you couldn't get on the MRI table, who was taking the kids to the parks and practice, and were you missing work? I mean, give everyone a sense, what was going on in your life? I mean, how was this affecting your life? I mean, because something had changed and you're probably like, Erica, do I just need to toughen up? I've been dealing with this for 20 years or what?
So I would have to sit down in the middle of making my kids' lunches. I couldn't stand long, or I'd have to lean against a wall just to take some of the pressure off. Getting in a car to bring them places was rough. I'd have people help me. And then at work sometimes, I'd have to maybe skip out taking a patient and somebody would help me out because I couldn't do it. Putting the compression stockings on patients, other nurses would come and help take the slack because those were little things I couldn't even do.
And those are the tight stockings, the hose that you have to put up and roll and very tight around a patient's leg and require a lot of shimming and pushing and those sorts of things. So you were beginning to not be able to effectively discharge your job and do your duties at work, in addition to doing things around the house, and that's what sort of prompted you to see a doctor and get an MRI. Because was it going through your mind that, Erica, I can't live like this? No one wants to. I mean, the person who wants to get in line for back surgery is the same person who wants to get in line and get a splinter in their hand, right? Nobody ever wants to say, I need back treatment. I need it can't be me, right? But I mean, this is affecting your life, both personally and professionally, to the extent that it's going through your mind, is my understanding, and I want you to elaborate on that for everyone.
that you can't live like this?
So at this point, I still never even thought about surgery because I just always tolerated the pain, and I just thought this was my life. I couldn't, if I wore heels, I was out of commission for a week, or long car rides. And then one morning, I woke up with my legs felt like they were sleeping, tingling, and it never went away. And I had numbness, tingling. It felt like lots of pressure, weakness. Like I could walk, but it was like felt like bricks on my legs. And I just knew from all these years that that's it.
So
That's when the pain. It's not just pain anymore. It's bad.
So you knew something was different one morning, where your symptoms have changed. And I think that's important for people to understand is when symptoms, long-standing symptoms change, don't dismiss it. You're being a nurse, you were clearly able to process that and say, hey, my legs, I can't feel them right, there's tingling. You sought medical treatment and got an MRI scan and listened to the soft rock while you did it and had, but you were debilitated to the point where, forget being a nurse, forget taking care of the kids and wearing heels, you couldn't even get on the MRI table and lay down and get the MRI. So you're pretty darn debilitated by this. Are you having people help you out do things? You're missing work, and are they helping you out do things around the house with the kids, or you're kind of just telling them they have to help with the laundry? Or tell us a little bit of what that was like, because you'd lived with it for so long and you had these flare-ups, but this time it was different. How was it affecting you personally?
Well, I was very scared because I just didn't know what was next. I had my aunts, sisters helping me a lot, my husband. We have a dog that's 20 pounds. I couldn't pick him up anymore. Just everything. Bending down to get the dishes out the dishwasher. It was all... And I like to do, and I couldn't.
So simple tasks were really beginning to get affected. You get the MRI, and then you see a pain management doctor who does what's called an epidural steroid injection. So for everyone understands, steroid is placed around the nerve and a tissue around the nerves to decrease the swelling. And the idea is decrease the swelling of the nerve and the tissue around the nerves to relieve pain. So you come in and get one of those injections, right? And tell everybody a little bit about that, because people always hear, I got the shot. And tell us a little about that experience.
So you just go, you get on a stretcher, you go to a room in the OR.
So you're in a hospital or surgery center, you check in, they start an IV, give you some medications, again, give you a couple of martinis or a margarita, whatever your flavor, and then they use x-ray and put the medication very near the nerve, right?
Yes.
Did that hurt?
No, he numbs up the area, and it's just like a little prick, and then it's numb.
And after, were you like, that's it?
So after, I get to recovery, and I felt like Superwoman. I felt like I could do everything. I'm like, wow. I got off. I think I even cleaned my own bed, and they're like, okay, Erica.
Wait, repeat that. So you clean your own bed in the hospital?
Because it was where I worked in recovery. But I just felt
so you're doing your
good.
job as a patient?
Because the pain went away, and I hadn't lived like that in so long. So
you wanted to do what you were good at, because being a nurse you're good at. You're in the recovery room. You're in the recovery room as a patient, and they put numbing medicine right there so it numbs the pain fibers. So you're ready to roll, and you just start doing the recovery room nurse's job for her on yourself?
Yeah. And
never heard that.
They were like, you still need to take it easy for 24 hours, even though I was ready to rule the world.
So you get home, ready to rule the world. Did everybody say, Mom's back? Walk us through that when you got home. Did you pick up the dog?
No, I don't think I did, only because I knew I wasn't supposed to. I'm a rule follower. But, and then I was going to physical therapy, and it got a little better, and then started getting worse again.
How long did the injection, how long was it? What was the duration of that?
I would say 2 to 3 months. I felt good. Although the pain started coming back, but it wasn't as bad as it was before the injection, but it slowly started.
Gotcha.
coming back.
So you got some really good relief for maybe a couple of months, started some physical therapy to try to open things up in your back, and did that for a few months?
5 months.
5 months.
Mm-hmm.
And when did it start? And what's going through your mind on these first 2 or 3 months where you have the injection? Do you think, "Whew, I made it. I'm not gonna be one of these people." You're still not thinking surgery. Like, tell everybody what's going through your mind once you get the injection and you're doing well.
I was lucky to, like, come into contact with, can I say Dr. Martinez?
Yeah.
Dr. Martinez. I work with him, so he was able to help me, and I just thought that I was lucky to be in at a place where I could have this done, and it helped.
So you were back to kind of living your life in ballparks and wearing heels again?
I was always nervous.
But you did wear them a couple of times.
I did.
All right.
But just it was almost like knowing what could happen. I wouldn't do it just to prevent.
Were you waiting for the other shoe to drop, or you really thought the injection, like, okay, I got it, I'm feeling much better, I'm doing most all the things I want to do? Did you have the dodge the bullet feeling, or were you like, man, there's still something wrong with my back, I don't know this is going to go away?
I just thought the pain was coming back, and I'd live with it forever.
But hopefully not like it was when your leg was numb and some of the symptoms that prompted you to seek the more recent injection.
Yes. And then as that wore off, all of a sudden, there wasn't anything in particular. It's just one day I got out the bed and bam, I had never been the same since.
Is it one leg or both legs this time?
Both legs got numbness, tingling, weakness, and I came to work and I told Dr. Martinez, I said, this isn't right. I knew it. I knew it wasn't just that pain I'd been living with. It was more. So
Dr. Martinez, everyone knows he's the one who's the pain management doctor, did your injection, and you got great relief from that. And so you're doing well for a few months, and then therapy, and then you wake up one morning, didn't pick up the dog and 40 pounds of dog food or anything, but you wake up and now both legs are numb, pressure, tingling, maybe weakness, and something's different, but you come into work.
Mm-hmm.
And so tell us, so you're coming in, you're driving in, how far can you walk before, like, you're having to stop every 10 feet because your legs are numb, or you're trying to hide it from everybody? I know you are, right? So
it almost felt like walking, like I just had bricks on my legs, and I just knew that it wasn't good. It wasn't good. So Dr. Martinez did an assessment, and I think he called you.
He did. And you got a new MRI, right?
Yes.
You had to go through that again. When Dr. Martinez told you, he thought your neurologic exam, you had weakness in your legs now, which was new. He thought there were some significant changes. When he told you had to get a new MRI, were you like, really? Or you were like, yeah, something's changed, I kind of need to get it?
At this point, I was just like eager to figure out what's going on, because it had gotten so bad.
And with the heaviness in your legs and the weakness, and being a nurse and having medical knowledge, what were you most nervous about or fearful about, knowing that things had progressed?
Well, I'd never had surgery in my life. I recover patients from anesthesia all the time, but just nervous about having to have surgery possibly.
So when you had these new symptoms and Dr. Martinez told you, hey, you need to get a new MRI, was that the first time that you thought, I may have to have surgery on my back?
Mm-hmm. I just knew it was bad.
Who's the first person you told, besides the mental voice in your mind, that you may have had to have surgery? Was it a colleague, a family member, or who was it?
I was at work and my coworkers, but they had all known how I'd been living, so back surgery's, the thought of it, I'd always been scared of, like, this is my back. But I can honestly say I went to your office and I knew, I'm like, if Dr. Thomas comes in and tells me I need surgery, I trust him. And he came in and said I needed surgery, and
What were you nervous about with back surgery? I mean, you recover these patients. You see patients who have back surgery. You've now told your coworkers at work, but you have a much different perspective than someone who's not involved in medical care. What were you most nervous about? Knowing at this point your symptoms had worsened, so in the back of your mind, if you were being honest with yourself, you were thinking, there's a real possibility I need surgery, so walk us through that.
so one of the things I always knew, and I think you had told me too, is, if you let the nerve die too long, you can have incontinence, and that is something that I did not want. And I wanted to do something before it got to where I couldn't walk.
You weren't having any incontinence or anything like that? Were you having any numbness in your pelvis or anything, or just numbness in both legs? Your butt cheeks, were they a little numb or no?
Yes.
Yeah, so that kind of really scared you. I remember that now. And we got a new MRI that showed that the herniation, and a herniation is a disc is like a shock absorber, was actually doubled in size. Actually, grab that model right there. We can kind of show people what it looks like to give them an idea. This is a model of the spine, and this is sort of cut in half, and I'll do it so everyone can see. These are the discs, which are the shock absorbers. These white are the bones of the spine. So it's like you're cut in half. Like this would be Erica's face and her back, and these discs, this is where the spinal cord and the nerves are. This disc is actually coming from the back, pushing toward the back and pinching and displacing a nerve. In your case, it was very substantial and it was pushing some nerves in both legs, and also intermittent numbness in the pelvis, pushing some of the nerves around the buttocks, and so it was a little scary. And when Dr. Martinez told you that the MRI had shown the disc herniation was larger and that you were coming to see me, were you relieved? Were you nervous? Were you thinking like, what I need to do for my job and my kids? All of the above. Kind of what was going through your mind? Because I think you said you kind of knew there was a real possibility you needed back surgery, and that kicks off a whole domino of things that will occur.
First thought, who's taking care of my kids? What, I'm gonna have to miss work. Just my life, it's now on hold. I'm gonna have to recover, and who's gonna do everything that I'm not doing? But I kind of accepted it before I even saw you, just because I knew I could. This was it. This was bad. I couldn't live like this. And I know when you told me, I cried a lot. And then, so after we scheduled surgery, my pain actually went away. And I was like, do I even need surgery anymore? But I still had the numbness and weakness and tingling. So I would literally try to do something to create the pain to show me that you really do need surgery. But it never really came back.
Like it was before.
Yeah.
You sort of went to your baseline pain. I remember that. So what happened was you were getting weaker, and as the nerve was beginning to die off, you began to get a foot drop, and you were like, the pain's better, but my numbness and neurologic symptoms are getting worse. And I was like, that may not be a good sign.
Right.
And so you when you tell us a little about, you having an experience of being a nurse and understanding, but you knew that you needed the surgery, and you said you cried. Was it because you were nervous about, I can't believe this is happening to me, or worried about, I hope nothing happens to me and have kids, or tell us a little bit about that.
Well, just going under anesthesia, I was nervous. Even though I know it's so safe, I see it every day. Just nervous because I'd never been under general anesthesia. And also back, my nerves. This is my nerves. I hope I don't get any of the risks that
you signed the piece of paper that tells you all these nefarious and scary things can happen. And so you end up going surgery, do a minimally invasive procedure on you. What's the first, it's interesting being a nurse from your perspective, being a nurse. You remember coming in the hospital, I'm sure you remember in preoperative or the holding area getting your IV. They give you medications to make you have amnesia, loss of memory.
And relax.
Relaxed. Do you remember that? And what's the next thing you remember after that?
Rolling on the stretcher into the OR room, and that's it.
That's it.
And I'm sure I pushed myself over onto the OR
think you
table,
did.
but I don't remember.
So you remember going into the OR, and do you remember being in the recovery room with your other nursing colleagues?
I remember waking up, my best friend recovered me, and I woke up crying because I was so happy that I was alive and that it was over.
Did you notice a difference in the numbness and tingling and weakness immediately?
I mean, I didn't even have pain. I know some of my patients do wake up with some pain temporarily. No pain. I took a half a pain pill the entire recovery, like at home, all recovery. I was so much better immediately.
So with the procedure, you only took 1/2 pain pill. That was after surgery, all in, meaning weeks after, months after. And I remember when I saw you in recovery, like, I can feel everything, and your pelvis, you're like, I can feel my butt cheeks, and you were really happy about that. And
it's amazing. My life has changed. I never knew how I was living for so long, getting in the car slower, I didn't even know you could get in and out of a car so fast. Everything is just, I wear heels. I don't have pain. It's unbelievable.
Yeah, that's kind of really part of the story is that, and there's many, many people like you who just accommodate. They say, I'm living with the pain. I stopped doing this. I stopped going out to dinner with my friends. I don't go to the mall. I go to the ballpark and try to stand in the back. I try to get somebody else to pick up my kids so I don't have to drive and sit in a car. All the things that you accommodate, you don't realize that at some point you've given up all those things, and when you have surgeries and successful surgery, it's like getting your life back, huh?
Definitely. The first few months I would still think about, can I do this, can I not? Well, and I know I was in recovery. And
you want to say you followed Christy's rules, our nurse practitioner, right?
Christy,
She's looking over there looking at you.
I follow the rules to the T, and I tell all my patients to do it because it's worth it for the 8 weeks, 7 weeks. You can't lift heavy things, but it's all worth it, and my life is better.
You started this journey when you were 16, having back problems off and on. Got a variety of treatments. Got fairly aggressive treatments, but taking a needle and putting it around your spine and the nerves around your spine. Therapy, medications. How long after surgery did you realize, hey, it may not be coming back? Like, this is turning the course of the ship here, and it's, I'm sailing away from the icebergs, and I'm going down to much calmer waters.
I would say 4 months, I stopped having just little feelings like, is it going to go out? Just because that's what I was, how I lived my whole life. But 4 to 6 months, I would say I'm 100%. I don't even, I'm back to going, I do Pilates again. I didn't even realize how weak I was. My muscles had atrophied because I wasn't using certain ones. And now I'm back.
You're back.
Mm-hmm.
So you're back working, back going to the ballparks, getting in and out of cars, not realizing you could get in and out so quickly. Would it be fair to say it gave you your life back?
It did. It did. It was the best thing I could ever did. And I don't regret it. I'd do it again 100 times.
And looking back, before surgery and after surgery, if there was one thing that you had some anxiety about before surgery, or an expectation, not necessarily an anxiety, that after surgery you could tell people, don't worry about that, or hey, I was expecting this and this didn't happen, or I wasn't expecting this, but this actually happened. If you could tell to some of the people out there so they could understand when they have surgery or anticipating surgery, don't worry about this, or make sure you're able to do this, what would you tell them?
to trust your doctor, and I feel like especially Dr. Thomas would never operate if he didn't think it was necessary. And if you're at the point where you need it, do it, because it will change your life, and you'll live so much better than you'd been living in pain and whatever you were suffering through. It's worth it. The pain post-op is nothing like what you have been living through. It only gets better.
It's worth it, huh?
It's worth it.
What was it like getting operated on, having your surgery and all your care at a place you work at every day?
Very comforting. We have good people that work here. It was, I just felt like I was taken care of.
Sure. Didn't make you nervous or anything? The fact that they were your friends, the fact that just people you worked with every day, and you knew certainly of their level of competency, that gave you more security than it did. You know, some people might be saying, I don't want to be around people that work every day, but in your case, it was quite the opposite, huh?
I don't know if I could have, I would have done it, but having everybody that I know and work with every day, friends, taking care of me, took a lot of anxiety away.
Do you have any more pain, numbness, or weakness, or no, you're...
None.
So we shaved off 10 years of your life, huh?
It's amazing.
That's awesome.
Mm-hmm.
Is there anything else you want to tell anybody out there who has back problems or anything about the experience?
I would recommend doing what, if you have to have a steroid injection, if you have to go to physical therapy, and try it. But if you get to the point where the doctor's like, you need surgery, do it. It's going to change your life. It's worth it.
Great. Mm-hmm. Well, thank you for your time. We'll let you get back to something you're really good at, not talking about surgeries that you happen, but recovery room and taking care of patients because they need you up there. And thank you, and if you can think of anything else, we'll bring you back, okay?
Thank you.
All right. Thank you.